Mr. Dripbiner, since your company, Acme Workers' Compensation Insurance Company, is responsible for Mr. Jones' work-related injury, I want to make you aware of treatment options that are available to him. Your injured worker is suffering with a herniated L4-5 disc. I would like to get approval for non-surgical spinal decompression to help restore your injured worker's herniated disc, alleviate his pain and return him to his job.
I'm sorry, but non-surgical spinal decompression is not in the workers' compensation fee schedule. It is not in it because there is a lack of high-quality peer-reviewed studies published in leading medical journals to support its use. There are other treatment options that are less expensive.
By other treatments that are less expensive, do you mean physical therapy or chiropractic?
Yes, both are less expensive.
I agree that both are less expensive. But you must understand that if physical therapy or chiropractic can resolve the patient's problems, then non-surgical spinal decompression is not necessary. Non-surgical spinal decompression is for patients that have failed to improve under chiropractic or physical therapy.
Well, for those patients we have epidural injections and surgery.
But those are not less expensive than non-surgical spinal decompression.
That is true. But they are in the fee schedule of approved services. Non-surgical spinal decompression is not in the fee schedule because there is a lack of high-quality peer-reviewed studies published in leading medical journals.
Are you aware that the American Academy of Neurology in their own physician guidelines states that there is no good evidence to support the use of epidural injections in the treatment of ridiculous spinal pain? Surgery has no good studies that show any success after 5 years and only a marginal success after 2 years. Both of those lack high-quality peer-reviewed studies published in leading medical journals. Why do you pay for them?
We pay for them because they are in the fee schedule.
So you say it isn't because they work that you pay for them, it's because they are in the workers' compensation fee schedule. What about all the additional cost involved in epidurals and surgery? Non-surgical spinal decompression costs much less, actually has a restorative impact on the disc, is far safer than epidurals injections or surgery. And non-surgical spinal decompression has a better success rate based on the studies that have been done.
Yes, but it is not in the fee schedule.
What about all the expenses related to epidurals and surgery, like more time off work, complications to the procedures, and higher levels of disability ratings and settlements?
Yes, that is true, but spinal surgeries and epidurals are in the fee schedule.
What about all the additional human suffering that is created by those ineffectual methods, the loss of human resources and all the additional expense that is created and passed on to employers through their work comp insurance premiums?
Yes, that is true, but spinal surgeries and epidurals are in the work comp fee schedule.
But don't you see how non-surgical spinal decompression could save money, improve outcomes, and save people from lives of suffering?
Yes, but non-surgical spinal decompression is not in the workers' compensation fee schedule.
Well, perhaps it should be.
Yes, perhaps it should, but non-surgical spinal decompression and not in the workers' compensation fee schedule.
Well, how about changing the workers' compensation fee schedule and provide for non-surgical spinal decompression?
But we don't need non-surgical spinal decompression, because we already have epidurals and surgery in the fee schedule.
What would be wrong with changing the fee schedule and adding non-surgical spinal decompression? Then it would be in the fee schedule, too. Patients could have a choice as to the type of care they receive. And large amounts of money could be saved in the workers' compensation system. What could be wrong with that?
Change is very difficult to initiate. Workers' compensation is a bureaucracy, and as bureaucrats we do not like to change.
Don't you feel any moral imperative to try and make the world around you better and improve the lives of people?
No. I am a bureaucrat and I am happy to follow the guidelines in the fee schedule.